transformation profiler. And again, we're going to spend our time in this participation management, and then we're going to review these final 4 tabs as well. So when you open the participation management tab, really this is the place where you're going to do all of your submissions for new CTIs. You'll see here that there is a drop down for your performance period. So since we did this process last year, PY2 is available, but you'll want to be sure that you're in PY3 when you're doing submissions for this year. But it does allow you to compare CTI submissions from each year. However, since PY2 was our first year doing it, you'll notice that there is not a drop down for PY1, but future years will be continued to be added here as we add more and more CTIs. Okay, so looking at this left-hand panel over here, program resources, this is just some quick links for you all. So this will get you straight to the HSCRC CTI program page, which has some additional information. When the user guide is published, it'll be linked here. And then finally, there's a link to directly email the CRISP support for any additional questions. Moving on to this middle period, this allows you to view CTIs after the enrollment period. Again, we are currently in the enrollment period, so won't be able to see anything, and we'll spend most of our time today in this enrollment actions period over here. Now, they're the same 3 actions from last year. We have this create new CTI submissions, this edit CTI submissions, and view my CTI submissions, but you will see a new button, create CTI from existing definition, which was added for this year, and so we'll start to review that later. So to begin, we're going to start with the create CTI and review this workflow. So when you click this button, to start, basically, you will see you want to select a thematic area. And this is really important that this is picked from the start, as there are fundamental differences to how the definitions are constructed. So on the right-hand side here, you can see that there are some details about the thematic area that you have selected. In this case, this is care transformation. But if I change and toggle between them, you can see that some of this information changes as well. And what also changes is the options for customization within that thematic area. So you can see that for care transformations down here, here are some of the areas that you can customize. And again, the workflow will follow for that. For each of these items, you can select no custom, which basically triggers a downstream workflow for you as a user to specify that customization, or you can select yes default, which essentially allows you to skip over that step, and any default parameter would be used there and no additional input is needed. So back over here on the left, each thematic area has a different trigger criteria, some that you can modify, some you cannot. For this one, for care transitions, you get the decision to either include or exclude the index episode of your CTI. Again, you can drop down and make that decision here. And then this other box down here, you can see it says trigger event. Again, this is a default inpatient discharge for your information, but the system does not allow you to make any changes here. So before you move on to start, you'll need to manually type a name for this CTI. We always recommend a concise name since we don't want it to be a paragraph long, but one that does allow you to easily identify and differentiate this CTI from others. So I'm just going to do a really bad one right now, but test CTI PY3 demo. And once you enter your name and you select save, you'll notice that a CTI ID is automatically generated. This is the unique identifier for your CTI. We always like to say it's very, very helpful for us if you include this number in any correspondence or questions you have with CRISP or the HSCRC, because again, that's the unique identifier. So it helps us drill down to the correct CTI that you are inquiring about and get you guys the answers that you need. For purposes of this demo, I'm actually going to select no custom for all of these thematic area options, and that will allow us to walk through these steps and look at the workflows associated with them. So again, no custom down here, and I will select next, and it'll sort of take us to the next phase of the workflow. I do want to note for any of these, while we recommend using the next and back buttons, it is good that you also continue to save, but the system will prompt you, of course, if you do not save anything on that page. So of course I want to select yes, and it'll move us on to the next page. So to start, this is the basic CTI information. I do want to note that on the left is a list, or really the workflow for all of the different customizations. As mentioned, we recommend, especially for the first time, that you use these next and back features to ensure we don't skip over anything. But if you're going back in to edit, you can quickly go to a section by selecting something from your left-hand menu. Okay. So for each of these pages, you will have instructions at the top. We obviously recommend you review these, and hopefully it answers commonly occurring questions. However, there is a CTI user guide. This is where the technical aspect of the for the CTI is, that can review the different clicks within the CTP if you need more information. But again, this is sort of, hopefully the main directions will be listed at the top. So to start on this page, the first thing that you'll be prompted to do is select your baseline period. So you will pick the start date from the system. Again, these are the ones that are available. I'm just going to click any of them. I'll do July 1, 2018, and the system will automatically generate the end date of a 12-month period here. So for this instance, it's 6/30/2019. The elements over here are, as you'll notice, is the same with this baseline end, are grayed out. And this is for really informational purposes only, since these are system generated and for your reference, but we did want to make that viewable for you all. Also, these will change. For example, once things have been submitted, you'll see that this grayed area status of unsubmitted will change to be submitted, and you also will show the approval date. Again, informational things you cannot go in and change. Sort of going back to that first question about what is the participation level here, it is at the hospital. So for this participant dropdown, you can see that there are all the hospitals listed. Most of our users and hospitals do participate at an individual hospital level. And if that is the case, you can go in and just, let's say, select your one hospital, and that indicates who's participating. But of course, we are aware that there are regional partnerships as well as system relationships that may require you to go in and select multiple ones. I'm just going to use MedStar as an example. If they wanted to include all of theirs, you can go in and select many of them, and this CTI would include participation from all of those. Now, we do ask that users who are or CTIs and users that have multiple hospitals, you please coordinate with the individuals across your system hospitals. We only need one CTI for, or one submission for each CTI. So, Franklin Square and Good Sam would not need to submit something individually. They can submit one jointly if they're choosing to participate together. So again, I'm gonna click anyone from here. I will do Carol. And then at the bottom here is this CTI description. And this is where we ask that you provide some information about the interventions or the care redesign efforts that you're taking as part of your CTI. No specific length is required. However, we do want to note that the more information we have in the description field, it is very helpful for us to assess the overall program. For those that were able to join the presentation by AAR a couple weeks ago, they utilized this descriptive field quite a lot when comparing similarities and differences. So again, the more information, the better. It just sort of helps us, I think, level set where some of the CT's eyes are and the intention behind them. So I'm just going to do test here. This again will be accepted. It needs a number of characters. Again, no minimum is required, but we hope that you guys can of course, add a little bit more here. So what I skipped over here, and I'll spend a second, is this hierarchy preference up here. And this is actually a new functionality that was added for PY3. And it is an optional element. So the purpose of this is for users to indicate their how they would like to order or rank their different CTIs. If you leave this blank, we will use the default ranking. Again, this field is not required. But if you're submitting multiple CTIs, you can use this drop down to basically indicate the hierarchy in which CTI you'd like to be ranked first. These numbers are all relative, so 1 will always be ranked first and 10 will always be ranked last or lowest. Additionally, if you are submitting CTIs and you happen to give two CTIs the same number, let's say you rank them both at 5, all the CTIs at the same level of precedence will follow the usual hierarchy rules, and therefore low volume CTIs will get higher precedence over high volume ones. And again, since this is not mandatory, if nothing is selected, we'll be using the default hierarchy rules. I do want to note that there is no requirement to go in order here. So for example, if you have 3 different CTIs and you know that your first CTI is your lowest one, you can pick 10, that's totally fine. Your next one is the middle, you could pick 5, and your first one you could, or the last one you could pick 1. It's all in reference to the order that they were ranked, but of course does not have to be done in a 1, 2, 3 order. I'm going to click save here. And again, using my navigation field at the top, I will click next to keep going on. So this brings us to the DRG criteria. So for any data elements or parameters where you may have a long list of codes, there is an interface for uploading an Excel document for this information. So you'll notice on each of these pages, there is a submission template, which will be required to download. And if you choose to do the Excel function, and once you download it, it will give you to this template. I'm going to click here. Hopefully you guys can still see my screen when I'm doing this. Sometimes it switches. You can see an example here. These are fairly straightforward, simple Excel sheets. Again, you will be able to enter sort of any information that you see, add lines, delete lines, and be able to follow this, this template to be able to upload. So I actually did create a list. So I will do upload new DRG list and hopefully choose a file from my list. Apologies if it's not there. Okay, so I want to do the DRG template demo. Open. So when you upload the file, it will let you know if it uploads successfully or if there are any errors. I would say the most common error we see tends to be like a formatting one. If there is a space in a number field or a character, like a period or something like that, that's likely where you may see an error. Again, hopefully it's fairly straightforward for you all to troubleshoot, but we of course can assist you if you are still experiencing some errors. So once I upload the Excel sheet, it will show up here. When you are coming back to this, you can use this manually edit field. And what you could do is say, oh, I actually just only want 2. And you can use the trash can function, or you can say, oh, I actually just want to add 1 more DRG. Again, this all can be done manually. If you're only making some small edits, we obviously suggest doing that. However, if you would like to come and add another batch of codes, you can use the append function, and basically what that will do is you use that same template, Excel template, and it will add those DRGs to the bottom of this list. Okay, so I'm going to next. So same with IACD 10. Apologies. Again, you have this download submission template. It is going to be a different submission template for each one. Again, hopefully you can see my screen, so you can see here. So we do recommend, of course, you guys just making sure that you're using the correct template for each one. Again, I think I already created a template for one. Yep, for this time. So I will, nope, it's empty. Let's see. Hopefully I did the right one. No, okay. Give me 1 second. I must not have actually filled that out. I actually, for the sake of time, I'm not going to upload this, but you can see it's the same functionality as I did with DRGs. Again, apologies. I thought I had pre-populated that before this. But again, you can add this as needed. I'm going to do the next function. Okay. So let's look at the chronic conditions. So the chronic conditions and actually these next couple ones are slightly more complicated. So they're not your straightforward, just enter in one field. So again, we recommend you utilizing this description at the top. For chronic conditions here, you have, I believe, 26 available chronic conditions from the CCW flag available for you to select. And all you have to do is check off the chronic conditions that you either want to include or exclude. So in this case, a lot of people, let's say, I want to exclude cancers. You select all of them, and then you use your drop down and say exclude. Alternatively, some people are focusing on a specific population. So I'm just going to click diabetes, hypertension, and COPD, and I want to include these. And you also have the option to determine the threshold of the criteria. And this basically determines if for your beneficiaries, how many of these chronic conditions must they have. If this is left blank, the default value here is 1. However, if I select 3, what I am saying is I want my beneficiaries to have all 3 of these chronic conditions that I have selected. Alternatively, 2, they must have 2 of these 3. And again, either left blank or by default, they must have 1 of these chronic conditions that I've selected. I'm going to save here, and I'm going to click next. Prior utilization. So prior utilization, is essentially saying prior to the trigger event, do you want to check for any other services? So for example, if I want a beneficiary to have at least 1 admission, so I'm going to do setting, inpatient admit, again, 1 admission in the, let's say, last year, I can select my window, 365 days. And what this is saying is, okay, for our beneficiaries to be eligible, they must have 1 inpatient admission in the 365 days prior to the triggering event. Again, all of this is customizable for you as well. And you can also change, you can look at other types of hospitalizations as well outside of admissions or ED usage. So I'm going to save this here and do next. Look forward criteria. This is looking at the settings of care that you want to include immediately following the initial discharge. By default, as you can see here, all of the settings of care are included. However, if you want to focus, let's say, on a higher acuity population, you could, for example, exclude home health agency and community, and it would just focus on those that were discharged to an inpatient, post-acute, or nursing facility. And I'm going to save this here and click next. I actually think I don't have episode length, but we can go back and look at that. So this is the model estimator. So once you've confirmed all of this information here in the workflow, you can select this generate episode estimator. Depending on the volume of requests, this may take just a couple minutes. It could possibly take a few hours, again, just depending on volume. But what this will do, it will provide you the number of beneficiaries that met the criteria in the baseline using the filters that you have selected and the total cost of care of those baseline episodes. From that estimator, you can use this table to the right and determine what the minimum savings rate will be for this CTI. Again, all that will be viewable for you. I'm going to save and continue later, and I'm going to just show you what that function does. It essentially just brings you back to this main participation management. However, now I can utilize this edit active CTI submission field. So I left, this is all I wanted to do for today. Okay, let me come back and review. I'm going to go in and select test CTI PY3 demo. That's the one that we're just looking at, and click edit active CTI submission, and it'll bring us back to this main field. I can see here that this episode length, I actually put yes default. So I'm actually going to change that and do no custom. And I'm going to save and do next. So I now have this episode length option on the left here because I have now said, nope, I want to customize it. And here again for care transformations, or actually I think for all the non-panel CTIs, the default episode length is 90 days, but you can go here and actually select as low as 30 days or up to 180 days for your episode as you would like. I'm going to change this, let's say, to a 60-day episode and save it. And this last page, so again, if I click next, it went back to that model estimate. If I make changes to here, you of course can go in and create this generate episode estimate again to ensure that you're looking at the most relevant baseline data for the inputs that you have entered. And then finally, this last page is this review and finalize page. And when you feel comfortable with all of your criteria that you've entered and you press submit, what this does is it will notify the HSCRC that you're confident with your submission, and we can begin the review process on the back end. Please note you are not required to submit prior to the May 31st deadline. However, it does give us a little bit more time so that if there are questions, we of course have some opportunity to reach back out to you. And you also can, a new feature for this year, use this PDF export function, and really basically it'll give a printout of all of the criteria that you have selected in a nice sort of readable, more user-friendly type of fashion. I also want to note that if you did click submit, and I'll go ahead and click it right now, and you do want to make changes afterwards, I'll go to view my CTI submissions, and I have this test CTI demo. You can go in and continue to make changes afterwards. We just ask that you re-click that submit button. So again, the HSCRC is aware that we're looking at the correct version, and we're notified that you've made changes since the last time. You also can have the opportunity to say, oh, I actually have changed my mind and I'm going to withdraw this CTI for this year. If you click the withdrawal submission, it'll just prompt you confirming your withdrawal. Again, you'll say yes. And it's letting us know that when we look at the final CTI submissions, this CTI will not be included. Again, nothing here is final until the 31st. So you can change your mind again and say, no, I actually am happy with this CTI. I do want to do it. Please go in here and click this reactivate submission. And again, it'll just let us know, yep, this is an active CTI that we'll include for PY3. So go back to the participation management. So that walked through the CTI submission as well as this edit CTI and view CTI1. I now will walk into this create CTI from existing definition. So the purpose of this functionality, and it really came from a lot of feedback from you all last year, is essentially to allow a user to use an old CTI as a template for creating a new CTI. So please remember that any modification to a CTI, again, even if it's an NPI or a zip code or just one DRG change, it does require a new CTI to be formed. However, rather than having to go through this create new CTI submission, all of those different steps, you can create a replica version of your old CTI and just make those small tweaks. So in this case, I am going to use another test care transformation. I'll use this one. I actually don't know what this one says, so we'll see this together. But you can select any of your ones. In this list, you'll see your CTIs from both PY2 as well as ones that you've made for PY3, and you can create a CTI from that. And it will bring you to this screen. The big thing that we do want to note is that we highly recommend you change this CTI name, even if it's just adding PY3 to the end of it, so that it has a unique name, but it will also be given a unique identifier as well. Here, it looks like there really wasn't a lot here that we can see, but here, all of the information that you had in this old CTI would be copied over. So I'm going to go ahead and emit, and you can see here, I'm just going to click on a couple ones. Let's say this DRG, there's a couple of DRGs that were listed already, zip codes, which is great. You can view what was already replicated over and then make tweaks as you want. So in this case, if I said, oh, I actually want to delete this one zip code, yes, and I'm just going to add one additional zip code. That was my main change for this. that is really the simple process that you would need to do to create this new CTI rather than having to go through the whole workflow from start to finish. So I'm going to save and continue later. So this is all of the sort of submission participation management. I see a couple questions in the chat, but feel free to take yourself off mute. The first question is indexed event. In this example, it is the hospital stay. Yeah, so for most of the index event, it is the initial hospitalization or the ED event in those cases, and you can choose to either include all of the costs associated with that stay or exclude it and have your CTI only start after that index stay is over. The next one is, how is create CTI from existing different than editing an active CTI? Essentially, creating a CTI from existing is editing. You can actually not go in and edit an individual CTI. Any modification that is made to a CTI requires a new CTI to be created. So only those that are using the exact same definition for PY, rolling over from PY2 to PY3, you would not need to do anything for. But if you are making a change for one existing CTI, you would use this create CTI from existing definition, make those tweaks, and notify us that the old CTI you will be disenrolling, and it has therefore been replaced by this new CTI. Hopefully that made sense. Okay. So I think that's all the questions we have for the participation management submission. One more. How then would we end the existing CTI if the edit says to? Okay, so to end the existing CTI, you would need to notify the HSCRC at that hscrc.care transformation at maryland.gov, or whatever that one is. I can put it in there. So you would need to notify us. So in the example that I just had, let me view my care transformation or care, my CTI submissions. In this one, I created this new PY3 one, so it's 10205. But let's say my CTI from last year was 01-111. I would notify the HSCRC that I am disenrolling 01-111 because I have replaced it with a new CTI. So unfortunately, you need to let us know via email there. There's no way to let us know in the system. But we also, in part of after the submission process, we will do checks to ensure that you don't have two basically identical CTIs, and therefore you have a major overlap issue. We would reach out and again help hopefully clean that up for people.
Jessica, this is Laura Russell from MHA. So I have a question. So it seems like if you were to edit an active CTI submission, so that's if you started a submission already and haven't saved it yet?
Yes.
Okay,
yes.
Gotcha.
So yeah, so basically once a CTI is created in this fiscal year for PY3, it will then become available for you to view in this edit active CTI submissions. And it's not edit old CTIs, it's edit active. So again, I know the naming here is a little bit hard because they all look very similar. But yes, the drop down would be here. And a way to see a more concise list is to view this My CTI submissions, and this is sort of all the ones that are available to you. So, and yeah, so yes, that is the main distinction between sort of those two different functions. Whereas this create CTI does allow you to pull over ones from previous years.
Okay, thank you. That's really helpful.
Okay, great.